Did you know that over 7 million Canadians are now over the age of 65? And that number is growing faster than any other age group. But here's what most people don't realize. New laws are quietly being passed that could drastically change how seniors live, retire, and pass on wealth to their families. We're not just talking about minor tweaks. Some of these changes could cut into your pension, delay your retirement, or even cost your family thousands of dollars in surprise taxes and fees. What's worse? Most Canadians haven't even heard about these shifts, and by the time they find out, it might be too late to do anything about it. Could your family's future be at risk without you knowing it? In this video, we're revealing 10 powerful new laws that every Canadian senior and their loved ones need to understand before it's too late. Stay with us.
Number 1. CPP changes and increased contribution rates. If you thought your Canada Pension Plan contributions were all sorted out, think again. Starting this year, CPP premiums are increasing, and not just for high earners. In fact, a new second earnings ceiling has been introduced, meaning many Canadians will now pay even more into CPP, especially those earning above $68,500 annually. This change is part of a multi-year enhancement plan meant to strengthen future payouts. But here's the catch. Retirees today may not see much of the benefit, while workers and employers are shouldering higher costs now. For seniors already on a fixed income or those planning to retire soon, this can throw a wrench into your retirement planning. You may see less take-home pay, reduced savings potential, and a delayed timeline for retirement goals. It also impacts self-employed Canadians the most, since they pay both the employer and employee portions of CPP. That's a significant chunk taken out each year. What's more, many Canadians don't realize that these changes might not be adjusted for inflation in a way that protects long-term value. So while you may contribute more now, there's no guarantee your retirement payout will reflect the same proportional growth. So what can you do? Start by reviewing your CPP statement of contributions online. It shows how much you've contributed and gives an estimate of your future monthly payments. This can help you adjust your financial strategy now before you're caught off guard later. Don't forget to subscribe for more updates like this, because financial surprises in retirement are the last thing you need. And hit like if you think CPP needs to be more transparent with these changes.
Number 2. Old Age Security, OAS, age adjustments. One of the most quietly controversial changes under discussion in recent years is the potential increase in the eligibility age for old age security, OAS, from 65 to 67. While no final decision has been made, the topic keeps resurfacing in policy discussions and budget planning documents. And if history tells us anything, where there's talk, there's usually action not far behind. This proposal could have a serious impact on future retirees, especially those who are low income or relying heavily on OAS to bridge the gap between retirement and full pension eligibility. Delaying OAS by just 2 years could mean thousands of dollars in lost support, money many seniors count on for basic living expenses like rent, medication, and food. The government argues that increasing the age aligns with longer life expectancy and helps sustain the system financially, but that doesn't ease the burden for people who may be unable to work longer due to health issues or a lifetime of physically demanding jobs. And for those in rural areas or industries with early retirement trends, the effects could be even worse. Another concern is that many Canadians plan their retirement timeline around age 65, assuming they'll receive both CPP and OAS at that point. If the age is pushed back, that planning goes out the window. People may be forced to dip into savings earlier, delay retirement, or increase debt just to stay afloat during the 2-year gap. The bottom line? Whether you're retiring in 5 years or 15, this is a change you can't afford to ignore. Now is the time to revisit your retirement strategy, budget for the possibility of delayed benefits, and explore alternatives like part-time income or private savings plans to fill the potential gap. Number 3. Inheritance and estate tax reform, proposed regional. For decades, Canada has stood out by not having a formal inheritance tax, but that may be changing. In recent years, there's been growing political and economic pressure to reform how estates are taxed, especially when it comes to capital gains at death. And while these proposals haven't been implemented federally just yet, certain provinces are already pushing for more aggressive estate tax measures, and families with property or savings could be caught in the crossfire. One of the biggest concerns is the potential change to how capital gains on death are handled. Currently, when a person dies, their assets are treated as though they were sold, and capital gains taxes apply. However, with rising home values and investment growth, the government is considering tightening these rules, making it harder for families to pass down wealth, particularly family homes, cottages, or small businesses. For example, imagine you plan to leave the family cottage to your children. Under the proposed changes, your estate might face a hefty capital gains bill, forcing your heirs to sell the property just to cover the taxes. What was once a family legacy could now be seen as a financial liability. Another concern is the impact on intergenerational wealth transfer, which is already challenging for middle-income Canadians. Without proper planning, families could lose a significant portion of their estate to taxes they didn't even know existed. This is especially true in provinces with higher probate fees and less generous exemptions. What makes this even more complicated is that many Canadians still believe inheritance tax doesn't apply to them. But under these proposed reforms, even modest estates could be taxed more heavily, especially if assets have appreciated over time. The key takeaway: estate planning is no longer optional, it's essential.
Number 4. Wealth tax proposals. In recent years, there has been growing political momentum in Canada to introduce a federal wealth tax, a move that could significantly impact high net worth individuals and their families. While often framed as a way to make the rich pay their fair share, the reality is more complex, and many financial experts warn that such a tax could have unintended consequences for middle-class families, especially those who own appreciating assets like real estate, farms, or small businesses. The most commonly proposed version of the wealth tax targets individuals with net assets over $10 million, applying an annual tax of 1 to 3%, depending on wealth level. At first glance, that may sound like it only affects the ultra-wealthy, but here's where it gets tricky. Many Canadians are asset-rich but cash-poor. That means people who own valuable homes or farmland may fall into taxable territory without having enough liquid income to actually pay the tax. This kind of tax could also make it harder for families to pass down generational wealth, since long-held properties and businesses would be subject to annual reassessments and tax pressures that reduce overall value over time. And unlike income or capital gains taxes, wealth taxes apply every year regardless of whether you sell or profit from the asset. Additionally, critics warn that a wealth tax could discourage investment and force the sale of family-owned assets, especially in sectors like agriculture, where land values have skyrocketed in recent years. This puts long-standing family farms at risk of being broken up or sold off, disrupting communities and legacies built over generations. While not yet law, the wealth tax debate is gaining steam, and if passed, it could reshape how Canadians build, hold, and pass on wealth for decades to come.
Number 5. Pharmacare Act and prescription coverage shifts. Canada is on the brink of a major transformation in healthcare with the introduction of the Pharmacare Act, aiming to create a universal prescription drug coverage system. While the goal is to make medications more accessible and affordable for all Canadians, especially those without private insurance, the rollout raises serious concerns for seniors, particularly those who rely on existing drug plans through retirement benefits or provincial senior programs. Many retirees currently enjoy stable, predictable prescription coverage through employer-sponsored retiree plans or provincial programs tailored for seniors. However, with the new national pharmacare system, there's a real possibility that these existing plans could be reduced or even phased out, especially if governments shift toward a standardized, one-size-fits-all model. That could mean less coverage for certain medications, limited drug formularies, or higher out-of-pocket costs for drugs not covered under the new plan. Another challenge lies in the transition period. As provinces and the federal government negotiate implementation, there may be gaps in coverage or confusion about which medications are included, creating added stress for seniors managing chronic conditions. Medications that are currently free or heavily subsidized could suddenly become unavailable or partially covered, forcing seniors to pay more out of pocket or change their treatments altogether. For those with complex health needs, even minor changes in prescription access can lead to serious health setbacks. And with many seniors already navigating multiple medications, frequent doctor visits, and fixed incomes, Even a small disruption in coverage can create a ripple effect of financial and health-related challenges. While the intention behind Pharmacare is positive, the reality for seniors may be far more complicated. It's a stark reminder that even well-meaning reforms can have unintended consequences, especially when it comes to the most vulnerable members of society.
Number 6. Long-term care oversight reform. In the wake of the COVID-19 pandemic, long-term care in Canada came under intense scrutiny, exposing critical gaps in safety, staffing, and accountability. In response, several provinces have introduced or proposed strict new regulations and oversight measures for long-term care homes. While these reforms are designed to improve care quality and protect residents, they also come with unexpected financial and logistical consequences, especially for families of seniors. These new laws require facilities to meet higher standards for infection control, staffing ratios, infrastructure upgrades, and regular inspections. While that sounds like a much-needed improvement, and in many ways it is, it also means that operating costs for care homes are increasing significantly. And guess who's covering most of that extra cost? Families. Private long-term care homes, in particular, are starting to raise their monthly fees to comply with new regulations. In some cases, seniors and their families are seeing price hikes of several $100s per month, with little to no increase in services. Even public and nonprofit homes are struggling to balance higher operating costs with limited government funding, leading to longer wait lists, stricter admission criteria, and reduced flexibility in care options. For seniors already in care, these changes can be destabilizing. For families trying to place a loved one, it means more complexity, higher costs, and increased pressure to find alternatives or make financial sacrifices. Additionally, some smaller or rural facilities may shut down entirely if they're unable to meet the new regulatory standards, reducing access in communities that are already underserved. These reforms, while well-intentioned, remind us that improving care quality must also consider affordability and access. Without careful planning, seniors could end up caught between safer care on paper and fewer real-world options when they need them most.
Number 7. Digital ID and healthcare access. As Canada pushes forward into the digital age, many provinces are rolling out digital ID systems designed to streamline access to government services, including healthcare, pension management, and prescription tracking. On the surface, it sounds like a positive step: faster access, reduced paperwork, and better integration across systems. But for many seniors, the shift to digital ID brings more confusion than convenience, and it could create barriers to critical services. Unlike younger generations who are generally comfortable navigating online platforms, a large percentage of older Canadians struggle with digital literacy. According to recent surveys, nearly 40% of seniors feel unequipped to manage digital government services without assistance. With the expansion of digital ID programs, tasks like renewing health cards, scheduling doctor appointments, or accessing tax documents may now require login credentials, smartphone apps, or email confirmations, things that are not second nature to many older adults. Even more troubling is the risk of exclusion. Seniors who don't have smartphones, stable internet access, or the knowledge to manage online accounts may find themselves locked out of essential health and social services. This digital divide can also increase dependence on family members for day-to-day tasks that used to be simple, like checking benefit statements or applying for senior discounts. Then there's the issue of privacy and security. Digital IDs raise concerns about data breaches and how personal information is stored and shared. Seniors, who are already prime targets for scams, may feel anxious about having their personal health and financial data tied to a single digital profile. While digital ID systems may improve efficiency for some, they also risk leaving behind the very people who rely most on stable, accessible services. Without robust support systems in place, this push for modernization could unintentionally deepen the gap between seniors and the care they need.
Number 8. Housing regulations on intergenerational living. As housing affordability continues to decline across Canada, more families are turning to intergenerational living, where parents, adult children, and even grandchildren live under one roof.
It's a solution that offers financial relief, caregiving support, and emotional connection. However, recent changes in municipal zoning laws and housing regulations are making this arrangement more complicated than ever, and in some cases, nearly impossible. In several provinces, especially in urban areas, new zoning rules are being introduced to restrict or regulate secondary suites, basement apartments, and multifamily dwellings. These changes are often framed as efforts to control population density or preserve neighborhood character, but the result is that families looking to build or modify homes to accommodate elderly parents are hitting unexpected roadblocks. Permits are harder to get, renovation rules are stricter, and in some cases, additional taxes or fees are applied for converting single-family homes into multi-generational ones. For seniors, this trend can be especially concerning. Many prefer to age at home or live with family rather than move into a care facility. Intergenerational living often allows for more personalized care, lower costs, and emotional well-being. But when local governments impose restrictive housing rules, families are left with fewer options, sometimes forcing seniors into long-term care prematurely or splitting up family units that could otherwise thrive together. There's also the issue of property assessments. Adding a suite or modifying a home to include a second living space can trigger a reevaluation of property value, leading to higher property taxes. What was meant to be a practical, compassionate solution becomes a financial strain. As housing policies evolve, it's becoming clear that intergenerational households are being overlooked. Without clear support or incentives, this practical living solution may fade, leaving seniors with fewer choices and families struggling to stay together under one roof.
Number 9. TFSA and RRIF policy adjustments. Tax-free savings accounts and registered retirement income funds, RRIFs, have long been cornerstones of Canadian retirement planning, but recent and proposed policy adjustments are subtly changing how these tools work, especially for seniors, and not always in their favor. While these accounts were designed to help Canadians save and withdraw funds more efficiently in retirement, the new rules could mean less flexibility, higher taxes, and more pressure to manage withdrawals carefully. One major area of concern is the RRIF minimum withdrawal rates. After age 71, RRSPs must be converted into RRIFs, and seniors are required to withdraw a set minimum percentage each year. But with increased life expectancy and longer retirements, these mandatory withdrawals can deplete savings too quickly, leaving seniors at risk of running out of money in their later years. Plus, because these withdrawals are considered taxable income, they can also push seniors into higher tax brackets or reduce their eligibility for income-tested benefits like the GIS, a guaranteed income supplement. On the TFSA side, there's growing frustration over relatively low contribution limits, especially in the face of inflation. While the TFSA remains one of the most tax-efficient savings vehicles, its limited yearly contribution room can make it difficult for seniors to grow their savings meaningfully, particularly after selling a home or receiving a lump sum inheritance. Some policymakers have suggested reforming or even capping the total amount that can be held in TFSAs, which could further restrict wealth-building options for retirees. These adjustments, while not always headline news, have a direct and lasting impact on how seniors manage their retirement income. Understanding how to navigate these accounts effectively and adopt to policy changes is now more important than ever for preserving financial stability in later life.
Number 10. Changes to disability and caregiver benefits. As Canada's population continues to age, more families are relying on disability and caregiver tax credits to help manage the financial burden of caring for elderly loved ones. But recent changes to eligibility criteria, application procedures, and benefit structures have made it increasingly difficult for both seniors and caregivers to access the support they need. These adjustments may seem minor on the surface, but they're having a major impact behind the scenes, especially for low to middle-income families. The disability tax credit, which provides a significant tax break for those living with severe physical or mental impairments, has seen tighter definitions of what qualifies as a disability. As a result, many seniors suffering from age-related conditions like dementia, mobility issues, or chronic pain are being denied, even when their daily functioning is clearly affected. The application process has also become more rigorous, often requiring multiple rounds of medical documentation and reassessments, which can be overwhelming for older adults and their caregivers. At the same time, the Canada Caregiver Credit, CCC, which is intended to support family members who provide unpaid care, offers limited financial relief, and many Canadians are either unaware of it or don't qualify due to income thresholds or relationship rules. This puts extra pressure on families who are already sacrificing work hours, personal savings, and emotional well-being to care for aging parents or spouses. These benefit changes are quietly shifting the burden of elder care onto families without giving them the tools to manage it effectively. And with the number of Canadians over 75 expected to double in the next 20 years, this is an issue that will only grow. For caregivers and seniors alike, staying informed and proactive is essential to protecting access to critical financial support during some of life's most challenging years. Canada's laws are changing fast, and if you're not paying attention, your future or your family's security could be at risk. Tell us in the comments, which of these changes shocked you the most? We read every reply. Watch our previous video for more insights that could save you time, money, and stress. And if you found this helpful, please support us. We put a lot of work into these videos. Hit that subscribe button. It's just one click, but it means the world to us.